Well, good evening and welcome. My name is Mark Davis, and I'm the director of Tulane's ByWater Institute. And we're hosting tonight's event, the plug-in series, part of the plug-in series here at Tulane. And here at the ByWater Institute, we call this speaker series Future Cities, Future Coasts, because we want to envision a sustainable, just, and equitable world that explores change and transformation in coastal communities. And of course, that means, not just holding events like this, but listening, researching, and translating the things you learn into practice. Tonight, our guests are engaged in innovative research and projects that can inform the options and decisions that communities will be making in order to determine the futures of their coasts. Now, part of this obviously involves technical challenges, things about designing our cities, restoring our coasts, living with water. But it's more than a technical exercise. It's also about the human dimension, how human communities thrive or won't, how they are fair or aren't, and how we learn or don't. And that's why I'm really pleased to welcome you tonight to this evening for a very timely discussion about the health disparities that we've seen as we've gone through this COVID-19 crisis, and how and what that tells us about what it takes to live sustainably. Our guest is Dr. Sacoby Wilson, and he'll be in conversation with our own Dr. Thomas LaVeist, who is the Dean of the Tulane School of Public Health and Tropical Medicine. And they'll explore and unpack the roots of some of the disparities that we've seen in the impacts in the COVID crisis, and put it in the context of environmental justice and how communities can be better informed by research and good practice to build healthier futures. I'll yield the floor now to someone who I'm very proud to call a friend and colleague, and that is Dr. Amy Lessin. Amy is an associate professor of minority health disparities at the Health Disparities Research Center at Dillard University here in New Orleans. And she is also an associate faculty member at the ByWater Institute. Without further ado, the floor is yours, Amy.
Thank you, Mark. Welcome, everybody. Good evening. I am Amy Lessin, and I am an associate professor in the Dillard Minority Health and Health Disparities Research Center at the Biology Department. I'm also affiliated with the ByWater Institute at Tulane. I'm really excited about this event because it's our way to announce this new collaboration between Dillard University's MHHDRC and Tulane University's A Studio in the Woods. This program is called Inspiring Health Justice, a collaborative art science scholar in residence program. So just a little bit about the Dillard University Minority Health and Health Disparities Research Center, MHHDRC. We are dedicated to improving the health of underserved communities in New Orleans and our surrounding regions. We research health and healthcare inequities amongst races and people, in addition to conducting research. And we also inform the public and hold events like this to address health disparities in communities. So this program's inaugural residency this year is titled Syndemic, as is the title of this event, and it focuses on COVID-19 health disparities. And the first scholar in residence, as Mark just said, is Dr. Sacoby Wilson, who is, as you'll hear a little bit more about him later, associate professor in applied environmental health and at the University of Maryland Prevention Research Center at the University of Maryland in College Park. He's going to talk about this a little bit more later, but just to give you a little preview, the word syndemic refers to multiple interrelated epidemics happening all at the same time, or a set of linked health problems involving two or more afflictions, interacting synergistically and contributing to excess burden of disease in a population. And it should be fairly obvious why that's such an apt term for the time we're living in. So starting in January 2021 and for the entire spring 2021 semester, Dr. Wilson has been working remotely with Dillard faculty members John Barnes, who's an associate professor of visual arts at Dillard, and Keith Morris, who's Associate Professor of Film at Dillard, and four Dillard Independent Study students, Aaliyah Arnold from Visual Art, Ildebert Promesse Lafouille from Film, Jermaine Robinson from Visual Art, and Joanne St. Charles from Film. And the students have worked together all semester and with their faculty and Dr. Wilson to create a film and artworks about COVID-19 and health disparities in our region. So the aim of this whole program, Inspiring Health Justice, is really to bring the arts and public health together to address our region's longstanding health disparities through creative, cross-disciplinary mentorship, and in focusing the energy and passion of our Dillard art students towards fostering health equity. So we're really excited to have Dr. Wilson here tonight and Dr. LaVeist as well from Tulane, and our Dillard faculty and students who will be speaking with us after Dr. LaVeist and Dr. Wilson speak. Dr. LaVeist will be moderating a discussion with Dr. Wilson tonight, and I'm very happy to introduce Dr. Thomas LaVeist, Dean of the Tulane School of Public Health and Tropical Medicine. Dr. LaVeist's research and writing has focused on several broad themes, amongst which are ones that are very important for the work we're doing and for our time and what we're talking about tonight, and include access and utilization of health services, mortality in nursing homes, social and behavioral factors that explain race differences in health outcomes, and social policy and the impact of social policy on the health and quality of life of African Americans. He does both quantitative and qualitative work, and he's been leading a task force this year that I've been on, which is the Louisiana Governor's Health Equity Task Force for COVID-19, and it's been a pleasure working with him. So Dr. LaVeist, I'd love to turn it over to you.
Well, thank you, Dr. Lesson. Thank you very much. And it's my pleasure to introduce my good friend and fantastic scholar, Dr. Sacoby Wilson. Dr. Wilson is an environmental health scientist at the University of Maryland College Park School of Public Health. He works in partnership with community-based organizations to study and address environmental justice and health issues and translate research into action. Dr. Wilson is director of the Community Engagement, Environmental Justice, and Health Laboratory, which is focused on providing technical assistance and research support to communities fighting against environmental injustice and environmental health disparities in the Washington, D.C. metropolitan region and across the nation. Dr. Wilson will give a brief remarks followed by a dialogue that he and I will have, and then we'll have some time for questions from the audience as well. So I'll turn it over to you, Dr. Wilson.
Thank you, Dr. LaVeist, for the introduction. Yes, I'll be giving brief remarks. I'm gonna keep myself on timer. I'm gonna hit the start button. So I'm happy to be here today. I'm gonna do a share screen, I have a few slides for y'all, and just kind of talk about these issues around environmental justice, around the syndemic, and what are we talking about today? So you think about the EJ movement, and you think about environmental justice. 10 days ago was the 53rd anniversary of the assassination of Dr. King. Dr. King, in many ways, is the grandfather of the environmental justice movement. What's the EJ movement? It's a movement fighting against the disproportionate burden of environmental hazards, locally wanted land uses on communities of color, right? On low wealth communities, on those communities that have been marginalized, that have been forgotten, right? You think about issues of landfills, incinerators. Go to Louisiana, think about Cancer Alley, that between Baton Rouge and New Orleans, that petrochemical corridor. You can go to your sister state, Texas, and look at the Houston Ship Channel, right? Where these hazards are, refineries, pipelines, they just, for some reason, tend to be primarily communities of color. So you think about, Dr. King's work, when he was assassinated, he was thinking about these issues of sanitation workers around labor rights, right, the exposures. And you see brothers carry around signs that I am a man, recognize my humanity, right? That's very important to the day because too many folks of color have been dehumanized. And you know the stories. You just seen more Black men being murdered, right? You have the George Floyd trial right now. You have police brutality, militarization, right? You got young Black girls who've been pepper sprayed. Young Black girls have been body slammed by resource officers. So the dehumanization of Black women, trans folks who've been killed, right? Look at the issues of school to prison pipeline, right? Just this structural violence in communities of color. And you can extend this to environmental injustice because it's structural pollution, right, state-sanctioned poisoning of communities. Look at what's happening in Mossville. So environmental justice is about where we live, where we work, where we play, where we pray, and where we learn. And it's about making environmental issues proximal, everyday pocketbook. Saving polar bears are great, but why don't we just save the people that live off of Bourbon Street, right? Why aren't we saving the people in Gretna, right? Why aren't we saving the people who are living there at our historically Black colleges, in rural areas, around, Grambling State, right? Think about communities throughout Louisiana. Think about communities throughout New Orleans who are overburdened by hazards, who are underserved by infrastructure. So you think about this being overburdened by these pollutions of facilities, these toxicants that cause cancer, that cause heart disease, that cause stroke, that mutate your DNA. That's what folks are experiencing. Then you got communities that are overburdened by psychosocial stressors, poverty, that intersection of race and class, right? Then these same communities don't have access to infrastructure, whether it be clean rivers and streams. Think about the issues of some of the folks who are dealing with sea level rise in New Orleans, folks in the state of Louisiana losing the coast. Those ecological resources that protect us from hurricanes, right? Those things are important to focus on. Look at exposure issues, right? Pollution exposures, PAHs, lead issues, right? Particulate matter. Some of the health outcomes that folks experience these issues. When you're overburdened by these pollutants, it causes health problems. Why is COVID so dangerous, y'all? I mean, you have communities of color who live in areas with high levels of air pollution. Your lung capacity has been reduced. Your alveoli, your lung sacs have been damaged. Your heart's been damaged. Your cardiovascular has been damaged. So COVID, SARS-CoV-2 comes in and sees you like you're an easy target to get exposed, to get COVID-19, to potentially die. So what are the long-term consequences for people who survive COVID, who go back into pollution-intensive environments? What are we doing about that? These are things to think about. Now, let's think about the Gulf Coast and climate change, right? We know that last year was the 15th anniversary of Hurricane Katrina, right? And we know that those who contribute at least the greenhouse gases are the ones most impacted by climate change. So the underlying economic and geographic and social vulnerabilities that put folks more at risk, right, for climate change. That's also important when we think about COVID. Last year, we had the most named storms in history naming storms, and when we name storms, right, in this country. Think about all the named storms that hit the Gulf Coast. We got into the Greek alphabet. What does that mean for places that are economically and socially vulnerable? What does that mean for folks who live in lower ninth? What that means for folks who live, near Lake Pontchartrain, or folks who live in Mossville, folks who live in Cancer Alley, or folks who live in similar communities, in our sister state of Texas, who have some of the same kind of petrochemical disparities of burden, right? You have to move and think about, again, if you go talk about Katrina, talk about Hurricane Harvey, right, recently. How many trillions of gallons of rain were dumped after Katrina? Harvey in Houston, about 30 trillion gallons. What does that mean when cities are constantly flooded? And who's most impacted? And you say, Dr. Wilson, what about the extreme winter storm we just had in the Gulf Coast? Of course, who again is most impacted? So if it's a biological disaster like COVID-19, a technological disaster like the Deepwater Horizon, or some chemical spill of a chemical fire at a factory, at a refinery in Louisiana, Texas, or if it's a natural or unnatural disaster, who's always hit first, worst, and the most? Folks of color, low wealth populations. So just some pictures from Hurricane Harvey. So what can we do? In a lot of my work, I focus on doing community-engaged research. It's all about, building up, giving the community an opportunity to do their own science. Let me tell y'all something. Anybody can be a scientist. You don't have to have a PhD to be a scientist. You can have professional and non-professional scientists. And people will say, well, why we have so much lack of trust in science? Because we haven't brought science to the people. We're not doing science for the people. A lot of our science is about extraction and not action. We're doing science on what's wrong with people instead of what's right with people, right? We're doing science that's very reductionist. We want to get into the genes, clean the air, clean the water, clean the soil, give people access to healthy housing, mass transit, healthy foods, right? Look at the root causes of why we have these disparities, these inequities, right? Some of the diseases that people have are symptoms, and we're looking at the diseases. Focus on the root causes. Focus on structural racism, right? Focus on structural poverty. So for me, when we're doing communication research, it's important to empower folks. I'd say I do empowerment science. I do liberation science, right? I'm focused on getting science into the hands of the people. Science is not an end for me. Science is a means to an end. And the end is solving these problems. So you think about community-based statistical research as a methodology we use in public health. Community-driven research is really, really important as well, because community members can do their own research, can do their own science. And that's important for us to think about. Community members are engaged in all stages of the research process when you think about CBPR, okay? You know, I like to talk about Boyer's fundamentals of science is my philosophy, right? We want to do science that's just about data collection, inquiry, but science that gets to, integration, multidisciplinary science, science of teaching, but really important is science of engagement and the science of application. That's what communities need when we're talking about environmental injustice. When we talk about this syndemic, which I'll talk about later. When you think about science, you want to value and uplift community and cultural knowledge systems, right? Community members who live with these issues in Cancer Alley, in these facilities, they are the true subject matter experts, as one of my mentors would say, Dr. Mills McLean in Savannah, Georgia. Folks who live there, they have what we call specificatory knowledge. So they can do science too, y'all. And then people need to understand that science has a major role to play. But if science is not being done right, then if it's done on people, that's a problem. So we have to decolonize science. We have to do less pain people science, less helicopter science, less science that's about what's wrong with folks, as I said earlier. We have to do science that really is about solving problems that is supplied and action oriented. And that's what the EJ community has been about. That's what EJ experts are about. That's what frontline and fence line folks dealing with EJ issues and climate justice issues, that's what they want. And I think it's important to, engage communities. But what are the two hands of engagement? What are the issues, impacts, opportunities, benefits, and partnerships, right? And then connecting these issues to food, faith, family, health, and jobs. That's my philosophy in the science that I do. Any problem that we work on could be connected to those 5 things: food, faith, family, health, and jobs. And then I also do citizen science. It's the way to democratize science, right? Again, give people scientific tools. So when you leave as a researcher, they still are making progress. The problem's being solved. It's just not good enough to study the problem again, to do inquiry and do knowledge production. How are we translating the action? Citizen science is a way to get people the scientific tools that they need. So I'm getting close to the end of my time, but it's important, again, as I said, that we do science. If we're gonna be anti-racist in academia, if we're gonna address this syndemic, we have to do more science that's about liberation from sacrifice zones, from people being poisoned, and more empowerment. Not empowerment, folks, our empowerment. How do we help science help people connected to the issues? That's my clock telling me to be quiet. Connect to the issues that they have, right? Actualize their power, right? So how can we use science to, oh, sorry about that. Clicking. This phone is not going off. That's really not good. But how can we use science to really empower folks and actualize their expertise and really to solve problems? I'm gonna go turn the clock off, but I'm gonna stop talking. Go ahead, Dr. LaVeist. I'll be right back.
Well, yeah. Well, thank you for that. Thank you for that presentation, Dr. Wilson. I have some questions. While we're waiting for him to come back, those of you in the audience, if you have any questions, we'd like to ask you to submit your questions through the chat. After Dr. Wilson and I chat for a bit, we'll be able to take some questions from the audience. So please feel free to use the Q&A to ask any questions you have. So Sacoby, I'd like to start by asking you about this term syndemic. This is the title of the program, and you alluded to it in your talk. Would you talk a little bit more about what that means and why it's so important in framing of COVID-19?
Yeah, thank you for that. And then just real quickly, that alarm worked way too well. So I'm happy to be back. Yeah, that's the term syndemic, as Dr. Lesson said, it's about this multiple epidemics we're experiencing at the same time, right? You can even say multiple pandemics, or it could be multiple biological conditions, like negative biological conditions that we're experiencing at the same time. So synergistically working together. So reason why it's important in the context of COVID-19, many communities that disproportionately impacted by COVID-19, where it relates to morbidity and mortality, they were already dealing with other, social determinants pre-COVID-19, right? So you can think about racism, right? As a pandemic, as a country, we've been dealing with the pandemic of racism, white supremacy since our founding, right? You can think about racism is baked in the walls of this country. Racism in America is as America's apple pie. And so racism is baked into our planning policies, but unjust planning, unjust housing policies, right? Unjust healthcare policies. So you have to take into account racism. Think about the issue of capitalism, how racial and biological exploitation of certain groups, the essential workers, right? So you have, as Reverend Lawson, when you eulogize John Lewis, talked about plantation capitalism, toxic capitalism, the haves and have-nots. Who have been the have-nots? These essential workers, disproportionately people of color, who then have to go back out, right, and be in environments where they potentially be exposed more to SARS-CoV-2. Then you have the pandemic of climate change, as I talked about, who is going to impact all of us, but climate change both reveals and exacerbates environmental justice, right? And so there's some folks going to be more impacted by winter storms, by hurricanes, by tornadoes, by flooding, sea level rise, urban heat islands, heat waves, and then the pandemic of environmental pollution. So those things were already disproportionately impacting folks of color, which made them easy targets for COVID-19. So COVID really made visible the populations that our policies, housing policies, economic policies, criminal justice policies, other policies made invisible.
Mm-hmm. So in many ways, COVID-19, you could think of it as kind of a case study in health inequalities, resulting from these policies, right? So talk a little bit more about that. How is COVID-19 a case study?
Yeah, so you think about, thank you for that question, Dr. LaVeist. If you think about the history of segregation and redlining in our country, housing policies, you think about our policies as relates to healthcare policies, you think about there are a lot of people who are uninsured and uninsured, but also folks who live in medically underserved areas, HPSAs, health professional shortage areas. And so because we haven't addressed, inequities and access to healthcare and to, healthy foods, and you think about some of our policies related to Medicaid, Medicare, if you think about some of our policies based on environmental regulations, for example, we have a lot of rules and regulations, but for some reason, it seems like people of color are not being fully protected or protected in the same way as their white counterparts. You can look at Flint, Michigan, for example. All they had to do was, comply with the lead and copper rule, right? So you can go on and on. There's a book called Color of Law that talks about some of these issues like differential applications of laws and regulations. Even as I said earlier, Dr. LaVeist, think about some of our school policies, even looking at property taxes, right, for public schools. If you have communities that are dealing with income inequality, right, and you have folks who have properties that are not as valuable or deemed to be as valuable as other properties because of living in sacrifice zones, or because of folks that have been getting access to loans, and because you have folks that have been have home ownership, right? All those are cascading effect when it relates to having a tax base to invest in our schools or having access to other kinds of infrastructure and resources. So, these issues are really, really important. But policies, I think, are reasons why we have a lot of the issues that we have with disparities. And again, COVID-19, again, is a case study. It's just another example of a disparity that we've seen in from other disease conditions with asthma, for example, cancer. They even look at HIV rates. I think you can go on and on across various disease conditions that you see a similar patterning due to our inequities in many of our policies.
But what's the reason for this? So the COVID-19 is caused by a virus, right? And so the virus does one and only one thing. It seeks to spread and replicate, right? It doesn't care about who it replicates with. It doesn't care about what the person of color is. Why is it that African Americans were and also Hispanics disproportionately impacted?
Yeah, I think you have to think about the social terms of health, right? So I mean, we're talking about social terms. I think those are really important. I think we got a little bit of background noise.
Yeah, can we have the host mute? Okay, thank you. Not you, Jacoby. You need to come back out. You're muted, Coach Jacoby.
Okay, I'm back. So if you think about, the social terms of health, I think it's important for us to think about these upstream determinants and these root causes, right? So you're right, Dr. LaVeist. You can look at African Americans, folks of African descent in this country. They can look at people who are Latinx, of course, they're not monolithic, right? And the disparities related to COVID-19. You look at our indigenous brothers and sisters, right? I mean, some of the issues that, some of the highest rates of suicide, some of the highest rates of diabetes, mental health issues, lack of access to infrastructure. One of the main ways to reduce your exposure to the SARS-CoV-2 is what? Washing your hands. A lot of our indigenous brothers and sisters who live in reservations do not have access to potable water. So these social terms of health are driving, conditions that lead to people having higher exposure risks to SARS-CoV-2. And then again, go to this issue of air pollution, Dr. LaVeist. You have a lot of communities have a lot of traffic-related air pollution or hostalized stationary sources of air pollution, right? But what happens with air pollution? You're exposed to particulate matter, dust in the air. What does it do? It damages your alveoli and your lung sacs. So you didn't get exposed to this virus. It's easy for you to get sick and you may not recover, right? If you do recover, what are the long-term consequences of having COVID-19 recovered and then going back to the same community where you're exposed to a lot of air pollution? And not just outdoor air pollution, but also indoor air pollution, whether it be volatile compounds or allergens, mildew, other biological agents. So I think there's a lot there. These social determinants of health are really important indicators of why the populations who've been impacted disproportionately have been impacted disproportionately, and why the populations who haven't been, maybe more protective, haven't been as impacted.
Mm-hmm. So I'm gonna change directions a bit here and ask you.
Yes, sir.
A comment that you made when we were talking about a week ago. We were talking about these disasters and resilient communities, and you made a comment about resilience, about how it's often viewed as like a virtue in the community. This is a very resilient community because it can bounce back from these traumas. But you talked about toxic resiliency. Can you describe toxic resiliency, what that concept means, and why is it important to think about this other side of resiliency?
Yeah, thank you for that question. So I was at I'm on the National Environmental Justice Advisory Council, NEJAC. NEJAC is a federal faculty that advises the EPA on on EJ issues, right? Environmental justice issues. And we had a meeting in, I think, Jacksonville, Florida a few years ago, and there was a faculty member from University of Puerto Rico who talked about, after Hurricane Maria, everybody came in, swooped in and got data, collected data. And it was some resiliency, like, why are you so resilient? You're so resilient. He said, he used the term, talk to resiliency. Like, I'm tired of folks talking about we're so resilient. It's toxic. Why you expect folks of color, those less wealth, those who are marginalized to continue to be able to bounce back? You're not saying the white affluent people are resilient because they never have to experience that insult. They never have to experience that technological disaster. They never have to experience these multiple disasters over and over again. So the term resiliency is never applied to them. And so we got them. So the point is, Dr. LaVeist, we have to move beyond resiliency. So less wealthy people, folks of color, are in the same boat as their wealthier white counterparts. Mm-hmm. If something happens, there's no, recovery period. There's no, Hurricane Katrina where it takes 15, 20 years for people to come home. And some people have never been, come back. They've been, they're going through climate displacement. They're going through climate gentrification, right? So the idea is, how can we move beyond resiliency to make sure everybody is at the same level of opportunity? Everybody's at the same level of infrastructure. Everybody's at the same level of access to healthcare. So those resources are already there. So it's really, Dr. LaVeist is we're talking about public health doing more about prevention, right? And having more precaution and better preparedness when it comes to these types of biological, natural, technological disasters, that people don't have to be resilient, that the things they need are already there, and that, they have the opportunity to bounce back in a way that's as quick as their white, wealthier, counterparts.
But that answer kind of makes me think about an experience I had moving here to New Orleans. It took my wife and I about 2 years to find a house. We searched and searched and searched for many reasons, but one of the things that I noted is, I bought an app that would measure the altitude of the house. So as we would visit houses, I would look at the altitude, how far below sea level is this house, right? And it was interesting that it appeared to be a correlation between altitude and the cost of the house, right? So it's, again, those who are able to, who have the resources to purchase a home that's more expensive, that's going to be at a higher altitude, less likely to have to be as resilient the next time we have a hurricane like Katrina.
Exactly. And the lower ninth, those are some of the folks that are most impacted by Katrina. And they were, you think about elevation,
Yeah.
You're exactly right. There is a correlation between sort of income, wealth, and so these impacts. So if you are wealthier, the resiliency is not really a thing you have to really worry about.
Yeah.
I mean, but you never. That's a different way to talk about resiliency, because that means we're putting people in some ways in this kind of expectation that, oh, it's gonna be really bad for you, but y'all are really good at coming back over and over again. That's not good for people's mental health. That's not good for folks' economic opportunity, because how are you able to build wealth when you're constantly, having to rebuild or constantly struggling or in survival mode during these disasters, or in a place that has a lot of pollution?
Well, humans only have a certain well of resiliency in them, right? So if you have to constantly go into that well and use that resiliency capacity you have, as sooner or later, you're going to come to a point where you're just out of resiliency and you're not going to be able to come back.
Yeah, exactly. I guess part of the toxic resiliency too. You go to that well so many times, you burning both ends, you're in survival mode, you're trying to so much, maybe that leads to premature mortality. Maybe that leads to reduced life expectancy. And how do you apply that across not just the individual level, but across a whole community, across a whole population? Of being resilient means you have reduced life expectancy.
Right. Yeah. So another comment, another thing that comes to mind, and experience moving here to New Orleans that your talk brought to mind is, Dr. Lesson mentioned that I'm co-chair of the Governor's Task Force on COVID-19 and Health Equity. And, in that role, I've been working very closely with the health department around equity issues. And I can tell you, as someone who was in the room, before we ever got a single dose of the vaccine, we were already talking about equity issues. We were already planning around equity. We were already preparing to not have inequities, right? So you've got a team of people, smart people, who are focused on how do we ensure that this distribution is equitable as possible. And we planned it, we plotted it, we thought we had a plan that would produce an equitable outcome, but it didn't work. We still have inequities here, even though we were laser focused on that. Talk to me about, you were talking about how racism is built into the fabric of the country. And, what does that say to you? What does that say to you that even though you had people who were very much focused on this issue, we were still not able to produce a distribution plan that didn't produce inequities?
I think part of our conversation, Dr. LaVeist, I think about the distribution plan doesn't produce inequities. So go back to my earlier comments where the folks who have limited access to food infrastructure, right? Limited access to healthcare infrastructure. Let's talk about pharmacies. Does everybody have a CVS? Does everybody have a Walgreens? Like some of these, does everybody have a Walmart? So the places where people were going to get vaccinated, right? Those are some of the common places. Let's map out those locations and go back to your same point you made about the elevation and the wealth, right? Yeah. Let's map the locations and look at the social demographic composition, the income level. You're probably going to see fewer. Oh, go ahead.
Not to cut you up, but that's precisely the analysis we did. We looked at the location of these facilities.
Yeah.
And we predicted, okay, if we don't come up with some strategy, these are the communities where we're going to have inequities because there's no infrastructure to deliver the vaccine. And then we came up with strategies of how we can get the vaccine to that community. Still produce the inequities. Yeah.
So I think part of it is, and you think about this, you have COVID, right? But there's a term we use in environmental justice, like the cumulative impacts of things, right? And things accumulate over time. Those inequities are baked in. So the work that you're doing, you have to think about not just the mobile vaccination, right? You have mobile vaccination, is that right?
Yes.
Yeah, mobile.
That was one of the strategies that we.
So mobile vaccination. You probably, had like a promotor's health navigator, folks in local neighborhoods, talking to people about COVID-19 and getting vaccinated, right? You probably had that as a strategy. But then, as you know, Dr. LaVeist, that it's that whole trust in medicine. And we can go beyond Tuskegee. We can go to Henrietta Lacks. We can go to the father gynecology and working on enslaved, African women. There's a lot of mistrust of medical system, of medical research. And so how did you address that part of it, right? That mistrust, that distrust. So even when you have people, one strategy says you want to have people that look like the people you want to get vaccinated out there doing the work. Even that strategy is not good enough if folks don't trust medicine and research.
Mhm.
I mean, that's kind of baked into the system too.
So we're going to open it up to the audience to ask a few questions, but I had one last thing I'd like you to talk about. So what can we do? What systematic or systemic changes are needed, and how can we move forward when we have a situation like this, even when we are predicting the inequities, preparing for the inequities, strategizing around it, still not able to produce a plan that doesn't produce inequities. There's obviously something very deep here.
Yeah.
You know,
I mean, that's a really powerful question, Dr. LaVeist. I mean, I think you said you actually answered the question partially. We have to have systems change, and I mean, so we have to have, look at the systems, and the interaction between systems. So we have to have change to our economic systems. We have to have changes to our way, our investments in infrastructure. President Biden, you saw the numbers of a $2 trillion focus on infrastructure. They're already debating and trying to cut some of it out with the Republicans, but the infrastructure will be important when it comes to sewer and water infrastructure, when it comes to climate resilience, when it comes to, we have one thing COVID shown also is we have a huge Wi-Fi divide, right? So what about rural areas of the country that don't have access to Wi-Fi, rural areas of Louisiana, when you have people who don't also at the same time don't have access to healthcare? We got to get infrastructure to the people who have the most need, the most vulnerable, right? And we also have to think about, like on the science side, the research side, our funders have to do a better job of funding anti-racism research, funding systems research. We know that NIH now has this new Unite program. It's a program that they're trying to focus on, dealing with structural racism in the biomedical research enterprise. I think that's long overdue, but that's work to be done there. Also, we got to invest in our institutions of higher education. A lot of historically Black colleges and minority-serving institutions are in these communities where people have these, where they are hotspots for COVID. They are hotspots for air pollution. They are hotspots for a lot of these environmental hazards. So Grambling State, we got to be working with institutions like Texas, Prairie View State, right? Texas Southern University. Go to Mississippi, you got Tougaloo, you got Jackson State. You got Alcorn State. I know those schools better because I'm from Mississippi. But working with other institutions of color as well that are training students who come from these communities. And then I think what's really important is, and this is something that President Biden is doing at the national level, President Biden's executive order on climate change, but this is a whole White House Environmental Justice Advisory Council. We're talking about these issues, right? There's a whole need to invest more in community-based organizations who are on the ground doing this advocacy work, doing the work, the activism work. You got the Lean Group in Louisiana. You got the Bucket Brigade in Louisiana. You got Dr. Buller and Dr. Wright's work. You got Dr. Wright's work at the Deep South Center for Environmental Justice. There are a lot of folks who are engaging communities on the front line, the fence line. I think there needs to be more investment in sort of the social infrastructure too, in these social systems to make sure those folks are leading the work and being at the table when it comes to decision making around zoning, planning, infrastructure, and how we are prepared for climate change and how we're going to invest in the climate economy. There's an opportunity for Louisiana to transition to a climate economy. And at the same time, as we're reducing greenhouse gas emissions, making the communities more prepared, we're also providing jobs for folks too. So that's another thing that needs to be focused on.
Yeah, thank you for that. So I'm going to invite my colleague, Dr. Lesson, back on, who's going to manage the Q&A process for us.
Thank you, Dr. LaVeist. Thank you, Dr. Wilson. We have some great questions. I'm going to start with one that that you haven't talked about directly yet, which I think is really important, and we've talked about it a lot, Dr. LaVeist, on our task force. And this is for both of you. What questions does Dr. Wilson, and I would ask, do you, Dr. LaVeist, have for building trust of African-American communities in medicine or medical treatments?
Yeah.
That's for you, Dr. LaVeist.
Yeah, I mean, well, the mistrust is earned mistrust. I mean, it's mistrust that's been earned over decades, in fact, centuries, right? And so we're not going to get out of this distrust overnight when it took us 400 years to get here. So, I think the mistrust is the result of untrustworthy behavior. The way to build trust is to give people experiences of you with trustworthy behavior, right? And so I think that the only way we're going to deal with this mistrust issue is time. it's, the idea that simply, having, a black person, a black doctor, be the messenger, it's not going to, in fact, I wrote, you may know, I wrote an op-ed in the New York Times about mistrust in the African-American community, talking about this very issue, about how it's urged mistrust, and that in spite of it, we still were asking people to get vaccinated. We made a video about it. Boy, you should see the comments in the comment section of the video on social media. There's a great deal of distrust. I mean, we're accused of being sellouts and everything because we're saying, we had people who actually worked on the vaccine saying, I worked on the vaccine, and people's comments was, you're a sellout because you worked on the vaccine. So we've got a deep problem, but that deep problem comes from a 4th century long genocidal attempt, and people are still reeling from that. So hopefully it won't take us 4 centuries to get out of it, but it's going to just take time before people will come to trust.
Do you have anything to add to that, Dr. Wilson? We will see some comments that you have about this in the film later on, but if you have anything to add to that.
No, Dr. LaVeist hit the nail on the head. I mean, he used the word genocidal. If you're studying, a lot of medical advancements were made on enslaved people. Right. I said biological and racial exploitation of folks. That's been a vein, a strain in the medical research. As Dr. LaVeist said, it's going to take time. That's all I got to say. I mean, he already said, I don't want to repeat what he said, but yeah. We go to the next question.
Thank you.
Yeah.
My friend and colleague, John Sullivan. John, I'm so excited you're here. Thanks for your great work, Dr. Wilson. And he has a twofold question. I'm going to ask his first one. How can President Biden's infrastructure effort be used to address the needs of environmental justice communities and adapt to the pressures of a changing climate?
Oh, thank you, John. Good to hear you out there, your question out there. No, I think it's an opportunity. I wrote a blog on Medium, and I said, would President Biden be the first climate justice president? And I've also made a statement that, and this, you may not take this seriously, there's only been 3 presidents in the history of presidents, I think, that actually put racial justice first. Lincoln, obviously, LBJ, obviously, and then President Biden. You may say there's some other names on the list, but of the 42, 44, 46, 46, only 3, right? And I think there's something there because if you look at the White House Environmental Justice Advisory Council, I just had a NEJAC meeting today talking about, the efforts of the EPA to contribute to Justice 40 campaign, right? I think there's a lot of opportunity for this administration to have some long-term impact and getting at some of these deep, not the trust issues, but some of these deep issues, these wicked problems that we face, right? So I think the infrastructure piece is really important as it pertains to climate resilient infrastructure, sewer and water infrastructure, transportation infrastructure. John, dealing with goods movement issues in the Gulf. I mean, the petrochemical corridor, as you know, we had to do something about that. I mean, so part of it, John, is moving away from fossil fuels. That's a big thing for Louisiana and Texas, right? But for us to move forward with climate change, we have to get off our addiction to fossil fuels, but we have to have a just transition because those are really high-paying jobs for a lot of people. So renewables that come in, we got to have something it has to be a one-to-one exchange. It cannot be, I'm making whatever, I'm making $70,000 and I get a renewable job and making $40,000. That's not going to work. But it has to be part of it too. So it's just not the climate resilient infrastructure. It's also the jobs piece that's important.
Do you have anything to add, Dr. LaVeist?
No, I mean, I think he's right, but I am becoming more hopeful that we'll get there. And looking at the proposals that the Biden administration has put out, I mean, I've been impressed by what I've seen. I mean, just the idea of removing all the lead paint, all the lead piping in the country, that alone sold me before I even looked at the rest of it.
Yeah, no, that's a really important. I mean, just real quickly on lead. I mean, I think it's from public health perspective. We know what lead does, and think about lead exposure puts a cap on. I mean, I like to say, how you gonna put your kids? How you gonna put America first? People, if you don't put your kids first. You got kids being exposed to lead. You putting a cap on their potential. So Dr. Lisa's right. If we can replace those lead pipes, think about the potential that won't be lost. I mean, multiple generations potential have been lost because of lead exposure.
Yes, exactly.
Great,
So
thank you. Dr. LaVeist, did I interrupt you?
No, that's okay. I mean, he pretty, Dr. Wilson said it.
Okay. Another great question is from Ishanika Williams. What would be a recommendation for a course forward as organizations who may not have a focus on environmental justice, but are realizing the compounded impacts with under-resourced communities, especially considering this as a case study?
You want to go first, Dr. LaVeist? Go ahead.
Yeah, I think it may be helpful not to even think about it as environmental justice. I mean, it's environmental justice, it's social justice, it's economic impact. It's many different things, and I think it all comes together in many different ways. So my research is on health inequalities, especially as it relates to African Americans and other people of color. I don't think of myself as an environmental justice researcher, but the work that I do, I think clearly we're working on similar themes of the work that Dr. Wilson does. So I think it's the issue. The issue is inequity. The issue is that some people are getting more access to resources that are necessary to live a healthy life, and other people are getting more exposure to factors that degrade people's quality of health and quality of life. That's the issue. So whether we use the term environmental justice and think of ourselves as environmental justice researchers or not, this is the issue. So the bottom line is, how do we create equity? That's what we need to be focused on. And that comes from many different directions. And I think every discipline, every field, every people from all different backgrounds need to be thinking about that. Within my sphere of work, the sector that I operate in, how do we create equity? How do we create opportunities for people to live the fullest life?
Exactly. And just to add to what Dr. LaVeist is saying about equity, across their life course, right? Like as an individual, and then cross generations. Like this, what we're talking about is, this is impacting people, cumulative impacts across multiple generations. So how can we create life course equity? I'll just say it that way, and intergenerational equity. And then as Dr. Lisa is saying, one of the reframing, and he said economic justice, you can just talk about the economic issues. If we don't have, think about if you had a don't poison people, you have a healthier workforce, y'all. You have a less social and health safety nets, right? Don't poison people. You will have more GDP. You will have more income produced. You would decrease the income inequality. People could buy homes. Don't poison people. Okay, I'm gonna stop there.
Yeah, a few years ago, I led a study where we calculated the economic impact of health inequalities, racial inequalities in health, and we calculated that at $2.4 trillion. That's it. I mean, we're talking about that is the size of the economy of the country of India, right? The 11th largest economy in the world. That's how much the U.S. economy is hemorrhaging simply because we have these inequities. So even if you're not convinced by the social justice argument, even if you're not convinced by the argument that this is the right thing to do, there's a utilitarian argument here. There's an economic argument. It's expensive to maintain these inequities.
Yep. On the back end, on the front end, folks, and on the back end, it makes no. I'm going Spockian terms. It is illogical. It is so illogical. We could be doing so much more when it comes to wealth, in this country, GDP, and it would help the country move forward. So it is un-American. Racism is un-American. You think American principles? It is un-American. It makes no sense economically.
Oh, but it is logical in one sense, though. So there are people who benefit from.
Oh, of course. I mean, on that side, yeah, of course.
So the wealth flows to a smaller pool of people as a result of the inequities in society. So there's a strong incentive, logical incentive for people who are benefiting from the system to maintain the system. And
Yeah.
so, but in terms of but you're right in terms of the kind of the principles of the American society,
Yeah.
where the people, run the country, but people continue to vote for people that don't necessarily produce the equity. We still have many of the states in the South have refused to expand Medicaid, which would cost nothing because it would be paid for by the federal government. So even though the people of Georgia, Mississippi, and Texas pay federal income taxes that was used to expand Medicaid in Louisiana, in Maryland, in California, in New York, they're paying the taxes, but they're not benefiting from that expansion because their state politicians won't agree to do it. But they continue to reelect those politicians.
Continue, and then just to add to what Dr. LaVeist is saying. So I mentioned the term plantation capitalism. Dr. LaVeist just described plantation capitalism and what he just said. And also, not just with Medicaid and Medicare, I mentioned Justice 40. And y'all can look at what Justice 40 is when it comes to addressing environmental justice in the country and climate injustice, right? But it's the same thing like Dr. LaVeist said. Are they going to accept those $40, Dr. LaVeist? They're not accepting the Medicaid care dollars and these dollars to address environmental issues, like in the state of Louisiana, with petrochemical operations or Texas, they might not accept those dollars as well. So how can we make sure the dollars don't get stuck at the state level and then get to communities with the most need?
Okay, before we turn this over to our students at Dillard, just one last question, which very simply is really about the historic refusal to spend scarce resources with minority communities. And I mean, I think you addressed this a little bit when you answered the question about President Biden's policies, but it's really about how can we solve these issues if municipalities, governments aren't willing to spend resources.
Yeah, I'll go back, pass it back to Dr. LaVeist.
Well, can you give me the question again?
Yeah, so the way it's actually worded is, in addition to needing time to help resolve these issues, aren't money and resources very important as well? Part of the problem has been the refusal to spend or very scarce resources with minority communities.
Oh yeah. Well, I would quibble with the argument that there's scarce resources. The United States is the most wealthy society in the history of human society. I mean, we have resources to do a lot of things, you know, and I think that there's a lot that we could be doing. You know, this proposal to replace all the lead piping in the country, this is a proposal that's about 40 years late. Should have been done back in the 70s, right? And we certainly had the capacity to pay for that, and it would have been less expensive back then too. So I think it's a matter of priorities and you know, and the fact that there's a lot of money in politics, and policy is driven often by, you know, the economic interests of the most powerful that don't necessarily align with some of these issues we're talking about.
And just to add to that, just an example of priorities, right? And I made a statement about, you know, only 3 presidents focused on racial justice, and this president's focused on a lot on environmental justice. You look at the people they put in the office, like Cecilia Martinez, who's second in charge of CEQ, Council of Environmental Quality, Shalana Baker, who's an energy justice. They have a new environmental justice division within the Department of Justice. But one example from a budget, President Biden's budget, I think, has like $900 million in the skinny budget, proposed skinny budget, focused on environmental justice. EPA, they haven't spent $900 million in environmental justice in the history of the EPA or the history of this country. $900 million in 1 year. So again, as Dr. LaVeist said, it's been prioritized. And then they're putting the money where their mouth is, right? This is a first. So a lot of these issues, as Dr. LaVeist said earlier, there's intersections, regardless if it's environmental justice, climate justice, you know, social justice, racial justice, economic justice. It's all kind of the same. It's the same system, y'all, regardless of what you call it. I agree that if they prioritize it and they put the money behind it, you know, now we have to figure out how do we make sure that money gets to the people that need the money? How do we make sure there's accountability in the system, make sure the dollars flow, block grants, text incremental funding, opportunity zones, regardless of how you feel about opportunity zones, you know, tax credits, renewable credits, right? All those dollars are going to get to these communities that we're talking about. We're dealing with climate change. We're dealing with COVID-19. You know, even the PPP program. How many, you know, small businesses of color, were they getting PPP dollars? No, right? We know they weren't getting those dollars. So making sure that with the folks with the most need are actually getting the dollars. I think that's going to be a big question. The will is there, but the system, structures, mechanisms for accountability, I don't think they're there right now. But that's a big thing this administration has to deal with.
Well, Dr. Wilson, Dr. LaVeist, thank you so much for speaking with us. We are gonna turn over to our Dillard students, and this has been a fascinating conversation already. So thank you. One of our Dillard students is having a lot of internet trouble. There's very bad rain here in the city right now, but Jermaine Robinson is here, as is Professor John Barnes. So Professor Barnes and Jermaine, if you want to unmute and show us yourselves. That would be great. Hi, Jermaine. And
how's everyone doing?
hi, Jermaine. It's great to see you. I'm glad you were able to come back. And John, are you there? He may have stepped away. There you are.
Wow, let me see. Unable. Let me see. It's telling me it's unable to start my video. I'm so sorry. So, okay.
Well, we can. Oh, there you are. Hello.
Good evening, colleagues.
So this is Professor John Barnes, who is the head of the art program at Dillard University, where I'm a professor. And this is one of our visual art students, Jermaine Robinson. And Jermaine has been working along with Aaliyah Arnold, whose internet is out right now, who I'm hoping may join us later, with Dr. Wilson all semester to produce some wonderful art. And I'm going to ask Jermaine some questions about the art and show it to you in a second. If John, you want to say a couple of words first.
Well, first of all, we're very honored to be a part of this program. It's been a wonderful collaboration between the health disparities, visual arts, and film. And I really would like to thank Dr. Lesson for her dedication and vision in helping us bring this all together. So this evening, Jermaine Robinson, who is one of our emerging scholars who graduates class of 2021. I'm sorry, not emerging. He's a graduating senior 2021. And he's a visual arts major, and he's done an incredible job of interpreting and absorbing the message of Dr. Wilson and creating some very dynamic works of art from it. So Jermaine, are you there?
Yes, sir.
Yeah, can you share your work with us that you made from the interactions with Dr. Wilson?
Okay,
So
so
Jermaine, yeah, go ahead, Jermaine.
this first piece is a digital piece I did on Procreate on my iPad. I kind of wanted to capture the business of the hospital during the time that, you know, everybody was at home and people that were in hospital were in there alone, and all they basically had were the nurses and the doctors. So I kind of wanted to capture like what we couldn't see from the outside, and actual emotion that basically like the virus itself, how it affected the patients, how it actually took toll of emotionally on the nurses itself, and not just, you know, the patients or their family. And on this slide, I use the same format in the same medium, but I kind of wanted to capture the hospital after dark. And that's mainly what it's called. It's kind of, well, not really kind of, it's basically just to capture the, basically like what the patients are scared of while they're there, and how they feel when they're all alone, when no one's there after dark with them. It's like their fear of, basically like they don't want to die. They're not, basically they feel alone, and they feel like someone's coming from them. And I have the, I used a lot of the Black Plague to kind of inspire the piece. So I took pieces from that and basically merged them together. Like for instance, I have the death moth kind of taking the person's spirit and bringing it and helping it to move along. So this piece is my favorite, honestly. It's the one I made during the residency at Student in the Woods. And I wanted to really capture the mask mandate and how it actually affected the world and us and everybody. Because it's like, we know it's mandatory, it's something that we need, but at the same time, it's like, for me, I should say it kind of like makes it hard for me to breathe, honestly, because the inspiration behind it was when I kind of had something going on at school that it really had me upset. But like, nah, I'm kind of getting nervous talking about it, but yeah. I had to basically like, I don't know why I'm getting lost doing this, but I apologize.
You're good, Jermaine. I think it was one of the things you talked about when we were discussing this is that it was kind of a response to both your own feelings and difficulties you were having around this, and you were having a really hard day.
Yeah, I
And
mainly was. Yeah, I was having a bad day because it was something dealing with school, but like I was going to my car, I had my mask on, and I just took it off in frustration. I was so upset. I was so mad. I was just like, I can't breathe. This mask is making it so hard to just everything. Like I remember just like basically hyperventilating, and like the mask kept just going in my mouth, and I'm just like, oh my God, I snatched it off. So at that point, I knew what I wanted to do for the painting, because that frustration, that anger I had over me is just, I wanted to put it on canvas. That's just how I felt. And I'm sorry, I kind of thinking about it, it kind of made me all over again. I had to feel it all over again, and I kind of froze up. I'm sorry.
that's okay. So one of the things I forgot to mention, and I think we can all relate to what you were saying about mask wearing, by the way. So one of the things I forgot to mention is that you and Aaliyah and also the other two students we're going to speak to shortly, Pramesh and Jawan, all were able to do residencies at a studio in the woods.
Yes.
So could you, which is this beautiful 8-acre site across the river in Orleans Parish, can you talk a little bit, and I know you made this painting there, can you talk a little bit about what it was like to have this residency?
That residency was honestly amazing. It was so peaceful. It was just a breath of fresh air, honestly, for me. Like going there at first, I was like kind of like, I was scared. I'm not even gonna lie to you, because like the setting, like the scene, it was kind of my first time actually being in the woods. But actually setting up, going around and looking at the landscape, it was just, honestly, I felt like I actually like stepped into nature for the first time in my life. So like while I was there, I actually like had my canvas, my easel, and I did that painting outside all Saturday morning, all Saturday night. I was outside until about, I want to say till it was dark. And I had to carry everything inside. It was just, I loved it, honestly. It was so peaceful.
And if you wouldn't mind, would you talk a little bit about what you've gotten out of doing this residency, working with Dr. Wilson and all of us?
I'm not this residency. Honestly, I've taken a lot out of it. It actually gave me a chance to put my skills towards something that actually means something, you know? Like I never really did something that actually meant something to other people and other, like throughout the world, or what they're going through, that they could actually connect to. So that's like one of the main things I really like took out of it, that I could actually like start doing more work towards something that more people could actually say, you know, I remember this time I did that, or I was in that time, you know?
I do. Well, I'm kind of devastated to learn that you're graduating, because I'm going to miss you so much. But
I'm going to miss you too.
I hope you come back to us and keep in touch. So I am going to go back. I don't want to. So John, unfortunately, it seems like Aaliyah's having so much trouble. She can't join us at the moment. I know you work really closely with her, and she also worked closely with her printmaking professor. Could you talk a little bit about, if not everything about the work, just a little bit about what you spoke with Aaliyah about, and these are linoleum prints. If you want to just
Sure,
a little something.
sure. This particular piece was the first in the edition of prints that she produced based on the pandemic lectures. And this deals with a dead tree with a dead root system, you know, and she researched that as a symbol of death. That was used in the 1400s during the era of the bubonic plague throughout Europe. And so she surrounded the dead tree with headstones that you know, are based on you know, I guess you could say some of the archetypes of the pandemic. You know, the public mandates, wear a mask. You know, the name of the thing that was actually killing everybody, COVID-19. She produced a, classic horizon line and created a texture pattern to create contrast between the foreground and the background. And so, she wanted the usage of symbolism to be very simple, easy to get, easy to digest. And so this was the first print in the edition. And at the top, it also asks if you've been, vaccinated, in this cloud at the top up there. Okay, so this piece was what she actually made while she was participating in a studio in the Woods residency. And this deals with the dichotomy, that many people face in terms of, their mental state during this era of lockdowns and pandemic disease, where the face on the right is the outward public face of everything is okay, but inside the face, the side of the face to the left, it's a very dark, worried, distressed personality. And so, her whole point was trying to demonstrate how some people are trying to hold it together and cope by putting a happy face first in these somewhat perilous times. And this piece was called Quarantine. And Aaliyah told me that she was seeking to create the environment and sensibility of the quarantine and in terms of the energy. And so this is a bedroom that has a empty bed because she wanted the viewer to place themselves into the picture plane, at least if not physically, mentally place your, these are the things. And so she has dirty clothes on the floor. She has a computer screen as well as a television screen, and it just has all of the negative news, the death count, the daily death tolls, the spread rate and stuff of that nature, and the graphs. And so, once again, there's a tree outside. That's another usage of that tree, and the division between the picture plane of the white space with the cut marks. That was her way of demonstrating a type of a slow, sluggish, somewhat depressed energy. So I think Aaliyah grew a lot with this particular group of images. As I spoke with her, with the printmaking professor Patricia Bernstein about her, we both noticed a lot of growth in her ability to communicate ideas. So this was a great research project for both of the students.
Thank you so much, John. Thanks, Jermaine. We are going to now turn it over to Professor Keith Morris and Promesse Lafouille and Joanne St. Charles from the film program. So Promesse and Joanne, if you can show yourselves to us. Thank you. And Keith, if you would like to introduce your students, and we're going to see a little bit of the film that the three of you made during the semester.
Sure. Hildevert Lafouille is right there, also called Promise, and Joanne is on here as well, Joanne St. Charles. Both these students were picked for working with me last semester. They did a great job working on an Amazon Prime short anthology that will see the light of day in the next year or two. They did a great job, taught a lot of the freshmen along the way, and made something really good. And it was about, we did a little monster movie, a little sci-fi monster movie, the ones that they worked on. And so I was thinking monsters, I was thinking of COVID, it's a monster, and voila, they were the first ones to be picked for this grant and to work on it. So Joanne, you want to say hi? Hildevert, you want to say hi, and then we'll roll the film?
Hey. My name is Jawan St. Charles. I'm a junior film major, business administration minor from Washington, D.C.
I'm Hildevert Promise. It's kind of noisy over here. I'm from Texas and I'm a film major. I'm a sophomore.
All right. Well, should we roll the film, Amy, a little bit of it, and then
Yes, please. That'd be great.
all right, so let me get it open and switch to sharing my screen. And shrink some things down. Go full screen. Full screen, and here we go.
60% of those vaccinated are white compared to 11.5% Latino and just 5.4% Black.
So I'm inviting you guys to take it if you want.
Vaccines are one of the greatest scientific inventions of humans ever. And there are multiple diseases that everybody used to get for thousands of years that nobody gets anymore because of vaccines.
I don't like vaccines at all. I get the ones that I need and I don't get anything else after that because vaccines are not made for our kind.
Because of all the past records, the way the medical field has treated Black people, they test us without our knowledge. So,
I mean, these diseases have literally disappeared because of vaccines. And so for me, vaccines are really important. I get flu shots every year. I get all the vaccines I ever need to get. And so I think if there's no medical reason why you couldn't get the COVID vaccine, everybody should get it.
we decided to head to the French border to find out what real people have to say about the situation.
Do you have the vaccine yet?
No.
Planning on getting it?
Everyone's tested, maybe. After a few years, maybe. No, we even have.
It looks like we lost Keith for a moment. I am sure he'll come back. Everybody's having trouble with their internet today all across the city. So in the meantime, Promes and Jawan, let's chat. Oh, there you are, Keith. You came back.
Internet madness.
Internet madness.
Would you like me to continue?
Yeah, why don't you roll again and then we can chat with Jawan and Promes. Yeah.
That's the second time it's cut off on me with this with this weather.
It's the night, yeah.
With his sister live the other night, Jen. I was driving Jen home the other night, 2 nights ago, and he has no intention still of getting vaccinated, which is just absurd.
Yeah. But that's, there's also, it's not just in the Black community, it's in the white community as well. There are people that just don't believe. They don't believe the government.
I don't trust it yet.
I think vaccines could do more harm to us than good.
At first, it was very prominent about the Tuskegee shit and about how they would practice shit on us. And so I feel like most of the people who are shying away from it are African American because we don't want to be tested again. We don't want to be lab rats again. Yeah. I feel like that's how we feel.
Because historically, like African Americans were tested on it first
Exactly.
for a lot of things. Even like gynecologists, Black women were tested first.
So I'm not against the vaccines because of that. I'm against it because of the history of vaccines in this country.
So I get that a lot from my students that they don't want to take it yet until more people take it. they don't trust it, so they want to see how it
They
pans
want to see how many people die first. So how many people,
No, I don't
how
understand.
many people get the virus and how many people have side effects before they take it? I don't understand that.
Will you take the vaccine when you're offered it?
Absolutely not. I'm not.
Why not?
Because I don't know what it does. It could probably kill me. No.
What if you give it to somebody else, even though it doesn't affect you next?
No, because I don't want to put them in harm's way.
But you will if you don't get the vaccine. Okay, next question.
I don't really understand the question.
Sorry.
Well, no, like who wants to take
Who
it, who
wants to
doesn't?
take it?
Yeah, I feel
Sorry.
like it's the same all around. Yeah.
Okay.
I mean, you have like your fucking Facebook moms that use essential oils that don't think you should have a vaccine.
My parents weren't gonna get it, and they got it last week.
Yeah, see.
Yeah, so her parents did get the vaccine, right?
And she's surprised that they did in Florida.
And she's wearing, I mean, that's kind of interesting picture. She's wearing a mask with a beer in her hand. That's how it should be. You're not drinking a beer, so keep your mask on.
Yep.
So when you're not drinking a beer, you're right. When you're not drinking it, keep your mask. When you are drinking it, do what you gotta do.
Look at two girls with their no mask, one girl with their mask worn improperly, and one girl with a mask on.
Yeah, so 1 in 4 people have the proper. They're wearing a mask and wearing it properly.
What?
There's no difference in the distribution economics of the vaccine than there is in voting rights, in access to information, healthcare information. It's like it doesn't have to. It's not black or white. It's socioeconomic. Those that have money will find a way to find a solution to their problems.
Texted me last night and
Jumping ahead, as per Amy's request. Is it these women?
Yep.
Amy?
Yep,
All right.
that's perfect. Yep.
Yeah. At first I wasn't, but because of my mother and because of my son, I said yeah. And plus I want to travel. I was like, yeah, I'm not gonna let it stop my life.
What would you say to young people, African Americans specifically, that are like scared to get the vaccine?
I say take your time and think about it. I said I'm gonna take the vaccine, but when I take the vaccine, it's gonna be close to the end of the year. I want to see the effects that it have on people.
So she's gonna wait. I got shit that makes sense. She just said your mom. You want to do it for your mama and your son. You don't gonna do it for your mama and your son. You don't wait till the end of the year. You wait till get your stuff scheduled in the next month. Okay, that's a problem.
Before I take the vaccine, I say to young people that's out in the streets, that's partying, they a little bit more reckless than we are, a little bit more older. Think about the people that you bring it home to. You out here, you partying, you bringing it home to your mother, your grandmother, your aunts, your uncles. You spreading it to people that has disabilities. We're the ones that have high blood pressure, diabetes, gout, cancer.
Stop. She's exactly right. She's talking about why you should get it because you have high risk members of your family who had comorbid conditions. Older folks who got diabetes, who got gout, who got kidney disease, who got other issues, who have cancer. But she said she ain't gonna get it till the end of the year.
When you going and you partying, you coming back, you're bringing it not just to yourself, you're bringing it to all of us. So think about getting vaccinated. Yeah. The vaccine doesn't stop COVID, it stops you from dying from COVID. So think about it. Also, get a little more educated.
I was gonna say, yeah, education is key. Get well informed.
Because I want to get educated on it. I'm not just gonna take it. Because I've never taken a flu shot. It's almost like the flu pandemic. I'm not just gonna take something just because the government says you should take it to stop the pandemic. I'm gonna get educated on it because a lot of times, as African Americans, we were never given the opportunity to be educated on things.
Stop. I mean, there's some interesting points she's making about the need to be educated, have health literacy. I say health literacy when it comes to public health, vaccines, etc. But to me, it sounds like she's been educated enough. She hasn't activated, implemented to actually get vaccinated.
This is what bothers me about so many people. It's just they know enough, and it's still not enough. It's never enough information. It's never enough education. And that's how they put it off, and put everyone at risk. And it's never.
Yeah, they train it
because
forever.
You know?
Yeah, you got one person that does this plot of multiplied by millions of people who have enough education, like you said, and who are not getting vaccinated. I mean, I got my first, dose. I'm going back in my second dose in April, and I mean, I have a PhD. I'm in public health, but basically, why she explained the reason why you should get it. That's a powerful commentary. In fact, she hasn't gotten it. It's like what's missing?
Okay, back to you.
Thanks, Keith. You can turn off your screen share. Thank you. Jawan and Pramesh, if you want to come back and chat with us for just a couple of minutes. So what was it like for the two of you to make this film? We asked you to work on a film about COVID-19, and can you just talk a little bit about some of the decisions you made and what that process was like for the two of you?
I would say to start off, it was kind of hard to figure out what we were going to start off with. Are we going to talk about the vaccine? Because there's so many aspects in this whole pandemic, from climate change to politics, and we're trying to figure out something to come together and talk about. So we decided to start off with the vaccine. The vaccine, that's something new that just recently, or not recently, came out, but that's a big topic lately about who's taking the vaccine, who's not taking the vaccine. So we decided to go that route.
For me, I was really excited. I've never done documentaries before, so this was an experience, and I was really glad that my professor chose me to partake in this project.
And can you both talk a little bit about what working as scholars and resident students in the residency with Dr. Wilson and Professor Morris, what you've learned from this semester and what this project was like for you?
We learned a lot of information about everything that's going on. I love this project we did. It taught me a lot about everything that's going on, how to convey my emotions through film, how to convey my messages through film. I love that the most. The meetings we had on Thursdays, it was just, we learned so much from filming to just everything.
For me, as a filmmaker, you always work with a lot of different people. So working as a team, as a collective from a different background was an everyday thing that happens for filmmakers. I enjoy how professional it was. We had scheduled meetings and just interacting and listening to Dr. Wilson, tell us all the concrete facts, the actual truth behind it, like from a doctor's point of view. So I enjoyed that too.
Well, I don't want to keep everybody too much longer. I think it's dinner time. So thank you both, all of you, so much for being here. And Dr. LaVeist, Dr. Wilson, Professor Barnes, Professor Morris. And thank you so much to the ByWater Institute, Studio in the Woods, for all the work we've done together this semester. It's been a wonderful project. And the National Institute of Minority Health Disparities for funding the MHHDRC, which funded part of this project. So thanks everybody, and thanks for joining us. Good night. Have a great rest of your night. Stay safe, and thanks for joining us.